Sorry to all the Lakers fans in the room, go Suns. But we are happy to have you here on Friday, June 4th, and welcome to the Fresno County Suicide Prevention Collaborative. Today, we have a couple of presentations that we're excited to share with you. But first, just kind of a little housekeeping. If you have any questions throughout the meeting, please use the chat feature to type in your questions. At the end of each presentation, we'll address each of those questions. All slides and presentations and notes that we discuss will be sent out to you in an email by Solomon, usually later today. So be looking for that. And then we do have a couple of announcements of upcoming events for the rest of June that we'll cover at the end of today's meeting. So let's see. Sorry, there we go. Okay, so today we have our first presentation is going to be from the Source LGBT Plus Center. And we're going to have Brian Poff present to us today. June is Pride Month, and so we thought we'd highlight and feature a couple of organizations in our community that are doing some great work and helping out with a lot of suicide prevention for high-risk populations. So Brian, I saw you on here earlier. If you want to take over, we're glad to have you and welcome.
Hi, everybody. My name is Brian Poff. I use he, him pronouns. I'm the co-founder and executive director of the Source LGBT Plus Center. We're in Visalia. We serve Tulare and Kings County, and now we have a partnership with you all in Fresno. As you can see behind me from my obnoxious background, that we are celebrating 5 years. We are a community organization that focuses on like peer support, education, and advocacy. And so today I wanted to share some slides with you if I can. I'm going to share my screen, and the first is a video of some of the folks that we serve in Tulare and Kings County, and then I'll get into presentation on the work that we've done specifically with suicide prevention and suicide prevention task forces, both in Kings and Tulare County. So I'm going to attempt to share the screen. Okay. And
the Source saved my brother's life, and it could save the life of someone that you love. Like your son.
Or your daughter. Or that someone could be you.
Or it could be your partner that needs the help.
The Source has helped me through some rough times.
Rough times like being out in school.
And that time that I was struggling with substance abuse and my sexuality.
And that time I was struggling to accept my child's gender identity.
And let's not forget this moment in time that the Source has helped me get through COVID with HIV assistance of care.
It's helping me right now too with my lost job and my lost routine.
The Source is helping me stay undetectable.
El Source me está ayudando a mantener indetectible.
And with resources like PrEP, HIV testing, and education, the Source is helping keep me HIV negative.
The Source is helping people with their mental health through virtual counseling and support groups.
The Source has helped me learn to lead.
The Source is helping local business owners by supporting and promoting.
And the Source is creating space for LGBT plus young professionals
like us.
The Source gave me adventure and community.
The Source helped me feed my family.
So let's help the Source right now so they can be here beyond COVID and into the future.
So that they'll be here for the high school kids like my drama students.
And for all the college kids at COS, especially those who took my sexuality classes.
Please help the Source right now so they'll be there for that person who needs to come out at 71, like I did.
and so that they'll be there for the trans kid who needs to come out to live.
And for the new person in town looking for community.
And for a person like me who wants to be a strong ally.
And they'll be there for Grandpa who needs to stay healthy.
And the source will be there for the parents who need guidance.
Help us, because we're just starting to change the world.
And there's so much more we can do if we do it together.
Now is our rare moment to secure pride for generations to come.
And we're gonna rise up, and we're gonna be proud, and we're gonna be outrageous. Woo!
Out and proud, Annie.
Yep, just like that. It's gonna be amazing.
And it's going to be with your help. So give now. Thank you.
So we're not asking for donations from you today. But I will keep the screen up if that's okay and share. I get really emotional every time I see that video because I know almost everybody in that spot. Those are all folks that we've helped. Though I know their stories, I know their trauma, and so it really gets me sort of every time. So I might take a second to recover. I'm also a crier, so I cry at the drop of a hat. But thanks for listening today. My name's Brian. I use he, him. I'm from The Source. Our motto at The Source is you don't have to be out to come in. And it's really important in our communities and in rural communities. Not everybody is safe to be out. And not everybody who comes to the LGBT center is queer, right? So we really wanted to let people know that our space is a safe space for allies. It's a safe space for community that needs to get access to resources. And just because you're at the center doesn't mean you're LGBTQ. And in fact, 5 years ago, we were afraid to open a center in Visalia. It was had never been done. There had never been a center in our area before. And so many of the folks that many of the community members that helped us get started and organized were scared to open a center. And in fact, when we opened The Source in May of 2016, we had over 450 people come through our center. Our center was like 400 square feet at that time. So they kind of came in and left. But a month later, the Pulse massacre happened. And so it really, really scared the community. The violence against the LGBT community was something that, many young people had never seen before. It was during Pride Month. We're coming up on the anniversary next week. And it was really, really traumatizing for LGBT folks. And I remember that time. It was really, really scary. So our mission is to cultivate spaces or provide spaces in our communities for LGBT people to learn, grow, belong, transform, question, and support. And so we used the LGBTQ there in our mission statement. We thought it was really cute at the time, but it's actually worked out really well for us. I mean, providing space for people is so important, especially in communities that don't have a lot of queer spaces. Typically, those spaces would look like community centers or a lot of times bars or bookstores or things like that culturally and historically. Fresno has a very vibrant and rich LGBT community. You have a Tower District. We don't have that in Visalia. We don't have that in Tulare County. So a lot of the stuff that has been done in our community for decades has been really underground. And I say underground, it's kind of funny because we are actually underground. Our space is in a basement. But it's been done out of safety and fear. And so it was really important for us to start to build community where it was visible. And so that has really served us well. Our vision is to cultivate new resources through education, advocacy, partnerships, and to unite and advance LGBT folks in the Central Valley, really. Tulare County is where we're we're housed, but we do pop-ups in Kings County, and we are now doing pop-ups then in June, starting in June, in partnership with Fresno EOC, to provide peer support, activities, education, community, and we're really excited about that project. So I can't like move forward without saying like, not everybody, I can't assume everybody knows what LGBTQ plus stands for. And so I always sneak a little cultural humility in as well. You know, L stands for lesbian, G stands for gay, B stands for bisexual, T stands for transgender, Q is for queer or questioning, and the plus is all of the other letters, I, A, A, 2P. There's a lot of acronyms, and it would take almost 30 minutes to unpack all of that. But we just wanted to touch on that right now. So why are queer spaces, or why are queer organizations like The Source so important? They're important because LGBTQ plus people face major disparities in health and human services, especially in rural communities. Trans people and people at greater risk for HIV infections are affected by a lack of resources, education, and advocacy, and The Source is here to change that. PrEP and PEP, pre-exposure prophylaxis, post-exposure prophylaxis, and HRT, hormone replacement therapy, are hard to find in our area still. And so we advocate for better efficacy for these sometimes medical intervention. Well, they are medical interventions to improve people's health care. In 2016, most doctors in Tulare County had never heard of PrEP, and it's been used since 2012 to prevent HIV. It's 90% effective, up to 99% effective in preventing HIV infections, and HRT is hormone replacement therapy. So Fresno's really lucky. They have a hormone clinic at Planned Parenthood, which is a really wonderful place. However, Tulare County does not have a hormone clinic. So we do have a Planned Parenthood, but you have to see your primary care physician. And a lot of times those folks don't know how to prescribe or how to start care for trans folks. That's getting better. We've seen a huge increase in access to care for trans folks, but it's still well below what folks deserve. And then The Source helped pass AB 2640 and SB 239. We supported those bills. They're one is a HIV decriminalization law, and the other is access to PrEP and PEP. So all of this is to say that, as you know, suicide prevention isn't just about interventions in crisis. LGBT folks deserve to live full and rich lives supported by the communities that they live in. And all of these things play into suicidality and mental health. And so access is really important. Visibility is important. So we take a really holistic approach when we talk about suicide prevention, especially for youth. I mean, any activities we can do with youth is suicide prevention, right? It gets them in interacting with other folks that feel like them. There's identification, there's rapport that's built, there's accountability, there's all kinds of stuff that can happen with a community that understands you. So LGB, lesbian, gay, bi rates and transgender rates of suicide are well above the average. Lesbian, gay, and bi people complete or attempt suicide at a rate of 4 times higher than their straight counterparts. And transgender individuals face rates of almost 8 times straight or cis counterparts. So those rates are really, really high, and they're really scary. So family rejection also plays a huge part in deaths of despair. A lot of folks who come out to their families will be thrown out of their home that day. 1 in 4 is the national average. 1 in 4 youth that come out to their families will be thrown out and become homeless that day. And there's also was a study done by the Williams Institute, and the trans folks that have attempted suicide, 50% of trans folks thought or attempted suicide, and 80% reattempt. So the suicide rates are really, really high. Suicide attempt rates are really, really high. And what we hear from our clients and friends at the source is that they can't find a therapist that affirms them. There's no one that looks like me, or they don't qualify for county mental health services because the assessment doesn't include PTSD. So like, that's one thing that we really want to change in our county systems is as people think about ACEs and talk about ACEs, knowing that LGBT folks experience ACEs at a disproportional rate. And PTSD is not assessed until they are usually a client, and we're really pushing for an earlier assessment because it would medically qualify a lot of folks who aren't covered through their health insurance for mental health services. 1 in 4 LGBT youth will be thrown out of their home for coming out. And that makes youth really, our youth homeless population is disproportionately LGBT. 7% of the youth population identify as lesbian, gay, bisexual, or trans, and 40% of homeless youth identify as part of the community. So those rates are completely disproportional. So rural pride is really important. We call it rural pride because we're in the middle of, farmland, and sometimes it doesn't really even feel like we're in California for LGBT folks, especially. It's really important. LGBT folks have contributions. Our experiences are valid. We're important to community health. We're important to community economies. And people who feel safe and included in their communities create communities and create lives that benefit their communities. That's what we believe. So peer support is the number one way that we've found, the number one effective way that we found we could build community and support folks. So we started the source with a partnership with PFLAG, which used to stand for Parents and Friends of Lesbians and Gays. It's a national organization. They have local chapters. There's one in Fresno. There's one in Tulare and Kings. And it's a support group. They do education and support for family members and friends of LGBT folks. And for a lot of communities that don't have LGBT centers or LGBT groups, this also serves as a community sort of engagement for lesbian, gay, and queer folks, as well as trans folks. We have youth activities at the source. We have a youth activities board. They host a Pride Prom. There's a leadership academy. We have a trans group with over 35 members that meet every week. They do activities as well. We have an HIV peer support group. Though we actually had one for 2 years, and now there's 6 different HIV peer support groups. And these were all community-led to begin with, and then they've been supported by county funds. So, MHSA helps us with our suicide prevention outreach, our pop-up centers, our education and advocacy activities, our trainings, our cultural humility trainings that we provide for free to schools and things within our county through suicide prevention task force money, which is really great. And the source has been lucky enough to tap MHSA funds through innovation projects like Connectedness to Community, which is a 5-year capacity grant, which was amazing for us because it helped us do really long research, like long 5 years it happens really quick, but it gave us the time to do the research about where the gaps were in services for folks, and to assess MHSA themselves. We're using MHSA funds to go through their policies and procedures, talk about trainings, assess their staff, their frontline staff, and their providers, to see where we can offer support and trainings that are culturally competent, and make sure that the contractors that contract with MHSA that are using MHSA dollars are following the standards of care and collecting SOGI data and all the things that we're supposed to be doing at MHSA. So we're really excited about that. We've made a lot of progress, and we've got 3 more years left in that. We also do social activities. So Pride by Celia is hosted by The Source. We put that on every year. We do other things like drag queen bingo, pop-up activities in Kings County. So those are actually a lot of fun. But most of the stuff that we've done with suicide prevention has been funded with prevention and early intervention funds through MHSA. And so we have a long history of providing PEI to communities in partnership with our Tulare County Mental Health Services with well, they call themselves Tulare County Mental Health, not behavioral. But Suicide Prevention Task Force in Tulare County supports our efforts for trainings, pop-ups, and things like that. So with Suicide Prevention Task Force funds, The Source has been able to provide clinician and provider trainings, free mental health services to people in crisis, Kings County and Fresno pop-ups, brown bag lunch and learns, where clinicians can come and talk to our contracted providers and talk about best practices for LGBT folks, especially trans and gender nonconforming youth is a big hot topic for a lot of the folks that come to those. Provide visibility and authentic inclusion, because we sit on committees and boards at mental health, so that our voices are in the room and we're not invited to the table after it's already been set. So we're in those rooms planning and talking about things. And investment with innovation funding was a huge, it was a huge win for our community, because it's the first time in Tulare County that MHSA has ever funded an LGBT specific project led by LGBT people. So it was groundbreaking for us, not groundbreaking at the state, but really groundbreaking for us. And all of these things create safer spaces and help with family acceptance, because a lot of times we become the family that, if there's been rejection in the family, the community becomes the family support system. So it's really important that that we're available to folks. So I wanted to share a little bit of data. I might be running out of time. I always do. But if you can see this, in the last 2 years, these are the people that filled out surveys. So we have trained over 635 mental health providers in the last 2 years since we've been working with Suicide Prevention Task Force. We also break everything down. So we collect PEI data as part of our contract requirements. And so we're tracking, like, who are we training? And the majority, as you can see, and this is not surprising, the majority of people who are providers in our area identify as straight. The second highest are bisexual folks, right? So that's like, we wouldn't know that if we weren't tracking this data. Most folks who've been trained identify as female. Second most is male, and a very small percentage, less than 1%, identify as trans. So that means we don't have a lot of trans identified providers in our area, which is really unfortunate. We have things broken down by sex assigned at birth, race, ethnicity, and primary language, veteran status, and disability. But overwhelmingly, we can see that 83% of folks identify as straight, which means that we don't have a lot of LGBT providers either. And so, you know, sometimes our folks don't feel like they can talk to somebody who's not queer, which isn't always the case, right? But there is a sort of like a safety issue for folks who've been rejected I hear it all the time. I came out to my therapist and they won't see me anymore. Or I came out to my therapist and they talked about their religion. Or we hear it all the time in Tulare County. And I just got 2 calls last week because the therapist rejected the person because of their sexual orientation. So we're really excited to start work in Fresno County. We're really happy to partner with Fresno Behavioral Health. Really excited to partner with Fresno EOC because they do such amazing work. And we'll start June 23rd, and we're going to do 2 pop-ups a month for a year and see how it goes. So the source will provide 1 piece of education or activity per month, and then the EOC will do another, and we'll just switch off like that, and we'll support each other in community and see how it goes. So thanks for listening.
Thank you so much. I appreciate 2 things that you mentioned. One is all of the holistic things that you do as a means of prevention, you know, especially with your youth, and I appreciate that. And the second one, what was it? There was like, oh, I should have wrote it down, but I appreciate all that you are doing for our community, and so thank you. Let me see if there are any questions for Brian. Please put them in the chat. I did see a couple thank yous. You guys are doing awesome. Let's see. Michael wrote out what ACEs stood for anybody who was not aware. Let's see. We're happy and proud of our partnership with you. Sounds like everyone's really thankful. Are there any specific questions that anyone has for Brian? And Brian, I think Solomon has your contact information. Would you be okay with anybody reaching out to you if need be after the collaborative today? Yeah.
Sure. Thanks.
Okay. Perfect. Yeah,
I'll put my info in the chat as well.
Perfect. Thank you very much. Okay. Thank you, Brian, for joining us. Have a good weekend. We are going to now hear from, we have another presentation. Hold on, I got too many windows open right now for the PowerPoints. But next we are going to have Jennifer Cruz with the LGBTQ plus Resource Center. And I believe she's on here. So Jennifer, please take it away.
Thank you so much. Really good presentation, Brian. Thank you so much for all of that. And I'm happy to be here. I usually would be in an office, but I just came from the flag raising at the Fresno City College. So time was short, so please excuse my blurred background in my car. So my name is Jennifer Cruz. My pronouns are she and her, and I'm the manager of the Fresno EOC LGBTQ plus Resource Center. We're relatively new, starting back in 2019, and we serve the population LGBTQ plus of all ages here in Fresno County. We did get a good start with many of, basically Brian's our hero. You know, they do all kinds of amazing stuff. So we started out with many of similar services, such as peer support groups and things, social events to bring the community together, art nights, open mic nights, karaoke nights in the center. That was all pre-COVID, of course. And as we were getting rolling and like Art Hop started really kicking and our Funapaloozas really started to take off, everyone got hit with COVID, so we had to go virtual. So our team is comprised of my boss, who's Misty Gaddy Blanco, and she is the sanctuary director. So for EOC, it's a gigantic community action organization in Fresno County. You have a umbrella that is Fresno EOC, sub-umbrella Sanctuary and Support Services, which started with the Youth Sanctuary in 1992 for runaway and at-risk youth. That has grown over the last 20 plus years into sanctuary housing, transitional housing for transitional age youth, permanent supportive housing program, Central Valley Against Human Trafficking Department, and now the most recent, the LGBTQ plus Resource Center. I was hired to start that program, and under my direction, we have Emily Johnson, outreach coordinator, Rebecca Rodriguez, who's case manager for our new substance use disorder programming. Rachel West is the community outreach educator and also soon to be the network of care liaison. There's a network of care happening that's focused on trauma-informed care and ACEs, and she will be kind of the connection between the network and all the EOC programs, but especially the Resource Center. And Justice Patrick is our community outreach specialist. The next slide. So at the Resource Center, as I said, this is just some of the things we do, but when we do open up again, and we hope to see Fresno do that mid-June, the drop-in space will open back up. That's basically a place for anybody from the LGBTQ plus community of any age to drop by. They can get a meal, get a drink, have a cool or warm space, depending on whether it's summer or winter in the Valley, meet with our outreach specialist or a case manager to find the resources they're looking for, maybe get connected with mental health resources or healthcare resources or food pantries, housing programs, any of the above. So that space is also, we had a lot of people who would just come to hang out, watch our TV, use our internet. We have tablets on site so people can job search or fill out apartment applications or get help maybe filling out FAFSA paperwork or Medi-Cal paperwork. And as we've been open, it's been kind of our goal to make as many connections as possible with the different resources throughout our community so that if somebody needs help with something like Medi-Cal or FAFSA, we have somebody that we can refer them to. If we can't help personally, we can refer them to somebody who can help them with that. We also soon will be having people coming into the center to meet with clients, people like attorneys who maybe could help with harassment or discrimination things in housing or education. Or an event we have coming up late July will be the gender marker name change paperwork. We're going to be doing a workshop on that. So we made a lot of partners, and we want to make sure basically that the LGBTQ community has access to whatever resources it is that they're looking for. We also provide LGBTQ 101 or competency and humility training. We are working diligently to get that into the schools, the colleges, anybody who will listen, basically. We've done one with Kingsview as a big mental health provider. Even businesses are contacting us now. We did one recently out at a orthodontist in Clovis. So that's something that is very valuable. And there's some things going on right now in Fresno that we're trying to get some training over to, whoever will listen, city council and everyone else. So we also have a map point located in the center currently. Unfortunately, that started with COVID, like the contract for that and COVID started at the same time. So it didn't go as well as we had hoped. And that project won't be extended after June 30th. But luckily, we've come up on this network of care project. So we'll still be able to be connecting the community with all the resources, hopefully, and having people refer to us for resources. And also, it's kind of what we do as EOC Sanctuary without MAP in general, which is like the multi-agency access point. There's several locations around Fresno, but EOC in itself under Sanctuary Support Services has its own outreach team. So we're already connecting the community as a whole to different resources and that kind of thing. The center is specific, like I said, to all age LGBTQ plus people. Next slide. So this is a little bit about our new programming as far as substance use disorder programming. We've received 2 grants recently. One is about prevention and education for youth 12 to 26. And the second one that we just got was the Youth Opioid Response Fund, which focuses in on people already misusing and abusing opioids and stimulants. So basically, the first one, we're able to go into schools. We've been into some of the rural high schools, like out in Fireball and Mendota. And we're looking to, we've met with Fresno Unified School District and one of the psychologists from Clovis Unified. We're hoping to get that information into all the high school aged people. We'll also, as we go back into in-person meetings, we'll have a group centered around that issue for that age group to come in and talk about, resisting peer pressure, what to do if, just fill in the blank, all issues surrounding substance use disorder. And we have coming up soon virtually and hopefully in person soon, a bunch of harm reduction type of programming. So we'll have some virtual stuff coming up. We also have had once a month substance use disorder presentations by Dr. Randazzo from First Steps to recovery for that age group, focusing on things like family dynamics around substance use disorder, healthy boundaries, the medical model of addiction. And so that type of stuff is, we're hoping, given the fact that our community is disproportionately impacted by substance use disorder, to have a positive impact in that area. For the youth opioid response, we are hiring currently 2 licensed mental health professionals. And we also have a grant we just got with City of Fresno and City of Mendota to put a couple of substance use disorder counselors out in Mendota and in Fresno for that community specifically. So that's more things we're doing around substance use disorder. And what our hope is to get all that information out. And when we do get back in person, I think July is we're scheduled to do something in the center around Narcan distribution and needle exchange, along with some education for the community. So that's the next point down about the satellite out in Mendota. And there's a talk about potentially getting out into Sanger with one of the substance use disorder people as well. So tell all your friends that are looking for licensed mental health professional jobs that we are hiring. And this last slide is basically how to access services about sanctuary and support services in general. Like I said, we have several different departments under our sub umbrella. So that's all the phone numbers, and I will also drop my email and phone number into the chat to contact me directly or my outreach staff. And just real quick to wrap it all into mental health, basically, as Brian said, all of the services that we provide are kind of a wraparound, proactive measure for the community to be able to have, connection, peer support, and access to the resources like mental health that they need in order to prevent mental health crises and suicide prevention. Like that's our biggest goal. And some of the research shows that being able to connect even to just one other person and feel accepted is suicide prevention, basically. I saw something pop in the chat. I will absolutely get a copy of that. I don't know if you want me to send it out email about our peer support groups, but we are also available across social media, which has really grown over the COVID age. Facebook, Instagram, Twitter has all of that information and even events for each group that is happening. So thank you so much for having us, and we'll really look forward to working with Brian and the Source. Like I said, Brian's our idol out in Visalia. So.
Awesome. Thank you very much, Jennifer. If you want to send a copy of that flyer to Solomon, he will send out an email at the end of today's meeting so that everybody could have it. And then please go check out social media and you could follow it there as well. But if you send it to us, we could print it, we could pass it out, we could do whatever. So thank you for that. Any other?
Thank you.
Yeah, of course. Any other questions? Brian's giving you some props. There's a question that says, do you know, if some of the program staff in those programs have gotten suicide prevention training? I think that their work could be, with their work, it could be another way to increase prevention.
So with regard to suicide prevention in the center, our staff has had some trauma-informed care training. We also have, some staff that is trained in like ACEs aware type stuff and crisis intervention. So we do receive phone calls sometimes that are, young people, not always young people, but often young people who are in crisis. And we are able to connect them with the resources right then of what they might need, whether it be, local mental health facilities, or maybe the suicide hotline or the trans hotline, or all of those types of things. But we are also, like I said, just recently part of the network of care, and we're going to be getting more training in the ACEs aware and trauma-informed care field. The whole staff will have that training.
Perfect. Thank you. Any other questions for Jennifer? No, if you do, could you put your contact information as well? So if anybody did want to reach out to you personally or connect with you afterwards, if they'd be able to do that. Perfect. Okay. Thank you very much. We appreciate you coming. And there he goes. There's her email. So thank you very much. Okay. I am going to share my screen real fast and have Alex present just a quick little about an upcoming event. So let me make this big real fast. Alex is presenting at this upcoming event, and so I thought it'd be more appropriate for her to share about it. Alex, do you want to talk about it?
Good morning. So I'm Alexandra from California Health Collaborative, and FCHIP will host a mini conference on trauma resiliency. They're going to have Jane Stevenson, who's the founder of PACE Connect, be there as the keynote speaker. We're going to have some breakout sessions. So one of them is Self-Care by Dr. Amy Parks and Andrea. So Andrea is from the Human Trafficking nonprofit. And then I will present on adversities during perinatal period, so pregnancy and postpartum. We will have a presentation on historical environmental health disparities. We will also have a presentation. It's by Dr. Thomas, and she has entitled that presentation as Out of Sight, Out of Mind, and in the Moment. And we also are looking at domestic violence and African-American and Pacific Islander disparities. So it's going to be a conference full of lots of information in regards to resiliency and how do we move forward. So there's the link and the cost.
Perfect, thank you. And I appreciate you sharing. Solomon will send out the link as well so everyone could register at the Eventbrite website. Thank you, Alex. We do have, I'm going to come back to that. We are skipping July's collaborative because it falls on the 4th of July weekend. So we will meet back August 6th, right at the beginning of school year again. So please join us then. And then I'm going to stop sharing for a second because Ahmad has a video that I think he's going to show. Yeah. Do you want me to show it? Yeah, okay. Let me go back to my, hold on one second, everyone. I got to get back to the link. Ahmad, if you have it. Oh, there we go. Okay, hold on one second, everyone. Sorry.
My daughter, Chloe.
Okay. And then, okay. So this is a video that is in, Maud, do you want to speak on it real fast before, since you're more informed on it? No. Okay. I'm just going to share the video. Sorry, I got it. And then you guys can, it's a quick 30 seconds, so.
Chloe was a beautiful, bright light. As being transgender, she struggled with her identity. She couldn't see past the darkness and reach out for help. And I lost my only child to suicide. We need to start talking about self-acceptance and learn the warning signs. Because I never thought this could happen to my daughter, and I don't ever want it to happen to you. I'm Allison. I live in Clovis, and to all the Chloes out there, help is here.
Okay, that is Allison. She is part of the LOST team here in Fresno County, and she is awesome. So she does a lot of work. As she mentioned, she lost her daughter. And so I love that commercial. I did see some footage of her filming that on Facebook a couple of weeks back. So I was excited to see the finished product. So good job on that one. And then Chris, did you have a NAMI announcement?
I just want to say thank you to everybody who has supported NAMI Walks, Your Way, our virtual event. We have raised, and we are still raising until the 22nd of June. We've raised just under $51,000. We're at $50,780. Last year we raised $35,000, so it's a significant increase. We had 38 teams come together. It was a great day, and I am just so grateful to the team at the Department of Behavioral Health for helping us live stream that day, helping coordinate the resource fair for people to come in and pick up resources that day. So just a debt of gratitude to all of you. And there's still time to support us if you haven't.
Awesome. Sorry, Ahmad, when I was sharing my screen, I couldn't see the chat. So he's having, I know, that's the issue. So he's having sound issues, but he just said that that ad is now running on TV, social media, and there's a Spanish version as well. So please take it off YouTube and share it on your social media. Chris, congratulations on the success of the NAMI walk. Are there any questions or comments from the rest of the collaborative? We do have it's the end of the meeting today. It's maybe because of summer, we're just gonna take off the rest of the hour. But if anybody has any questions or comments, please put them in the chat. I know we have a smaller group today, but we do really appreciate our presenters and the fantastic work that you guys are doing in the community. And thank you for coming on today and presenting and just all the work that you guys do. I love that. Okay. We'll be pushing out info soon on the new LGBTQ pop-ups with Jen and Brian. That's from DBH. And okay, I think with that, we are done. So everyone have a wonderful June and July. Happy 4th of July in advance. And we will see you in August. And take care. And thank you. You're welcome. And go Suns. Have a good weekend, everyone.